Medicare Supplement Plan N is growing in popularity, and many of our clients want to know, is this really the best value plan for them? So today I'm diving into Medicare Supplement Plan N. I'll talk all about the pros and cons of this plan so that you can make a more educated decision when it comes to your Medicare needs. So stay tuned. Hi, I'm Stephanie Apt. I'm an independent Medicare insurance broker, and my team and I are licensed in almost every state. And every day we help seniors to understand how Medicare works and to find and enroll in the best Medicare plan at the best price for their needs. Many of our clients do decide to purchase a Medicare supplement or a Medigap plan to supplement their traditional Medicare benefits. And one of the most popular Medicare supplement plans right now is Medicare Supplement Plan N. So today I'm going to review how Medicare Supplement Plan N works. We'll go over the pros and cons of this plan. We'll talk about how it compares to some of the other popular Medigap options. And we'll review how to determine if this is going to be the best value plan for you. There are other videos on YouTube that review Plan N. I have a couple other videos that talk about Plan N, and I will link those in the description below so you can check those out. But I think it's important to start off by saying that the type of Medicare plan that you choose should be based off of a few different factors. I don't believe that there is a one-size-fits-all Medicare plan that's right for everyone. So whether you are watching a Medicare supplement video or you're speaking with a Medicare supplement broker, you should never be choosing a Medicare plan based off of fear or uncertainty. My team and I like to take an unbiased approach, and hopefully you'll find this video to be an unbiased explanation so that you can make an educated and informed decision when it comes to your healthcare. And if you do find this video helpful, please go ahead and click the like button. You can subscribe to the channel if you haven't done so yet, and definitely be sure to leave all of your questions for me in the comment section below. Now, what is Plan N? In short, Plan N is one of the 10 standardized Medicare Supplement or Medigap, those two words mean the same thing, plans that are available to folks on Medicare. It has been one of the most popular plans, along with plans G and F historically. Plan N does have some fewer benefits than plans G or F, which generally means that it's less expensive in monthly premium. In many states, Plan N costs $20 to $70 a month less than Plan G. And with MACRA laws eliminating Plan F for anyone new to Medicare as of 2020, Plan N is growing in popularity now even more. So let's quickly break down how Plan N works. If you have Medicare Supplement Plan N, that means you have traditional Medicare as your primary hospital and medical insurance. This means there are no networks. So with Medigap Plan N, just like any Medigap plan, you can always choose your own doctors and hospitals anywhere in the country, which is a really great benefit. On Plan N, you have to first meet the Medicare Part B deductible before the plan kicks in, and that deductible is $203 this year. And then after you've met that deductible, you have almost full coverage for any Medicare Part A or B covered expense. However, Plan N does have co-pays that you will also be responsible for. The co-pays are capped at $20 for office visits and $50 for an emergency room visit. But if you are admitted to the hospital, then that emergency room copay would be waived. So on Plan N, your main out-of-pocket exposure is that $203 annual Part B deductible and the copays that you would pay for office visits or emergency room visit. And in this video linked up here, I go a little bit deeper into Plan N copays, how they work, and when you can expect to see them. So if you're considering Plan N, definitely check out that video. It has a lot of good info there. And the only other potential out-of-pocket exposure with Plan N is Medicare Part B excess charges. So what exactly are Part B excess charges? Part B excess charges can happen if your doctor bills over the Medicare approved amount for a certain service. Now, the vast majority of doctors that see Medicare patients have agreed to accept Medicare assignment, and that means they've agreed to accept Medicare's payment as payment in full, and they cannot bill you anything above the Medicare approved amount. They cannot bill you excess charges. However, in the rare instance that you see a doctor who does not accept Medicare assignment, that doctor could bill you up to 15% above the Medicare approved amount for that service, and those are excess charges. They are covered by some other Medigap plans like Plan G or Plan F, and they are not covered by Plan N. And once you understand what excess charges are and the fact that Plan N doesn't cover them, you may wonder, is Plan N really a good choice if I have this potential unknown out-of-pocket exposure with these excess charges? My answer to that is I think Plan N is definitely still worth considering for most people. You see, excess charges are really quite rare. It's actually pretty disadvantageous for a doctor to accept Medicare patients and not accept the Medicare approved payment amount or Medicare assignment. It's more of a hassle for the provider. So it's pretty hard to find doctors that will bill you anything above the Medicare approved amount. The Kaiser Family Foundation has an excellent article all about this topic, and I'm linked it in the description below here. The article goes into depth about excess charges, and they've found that over time, excess charges have gotten less and less. And most recently, they've found that on 99% of Medicare claims, there are no excess charges. So from a numbers standpoint, there's only about a 1% chance that you would see Medicare excess charges if you had Plan N. Additionally, in certain states, the ones you see listed on the screen right here, excess charges are completely illegal or they're limited. So if you live in one of the states that you see here, it's definitely worth considering Plan N, as it's usually an excellent value in those states. And even if you don't live in one of these states, you'll see that the chance of excess charges is really very small. There's also a pretty simple way to search your providers on Medicare.gov so that you can see whether or not they accept the Medicare approved payment amount. If they do, then they will not bill you any excess charges. That means they accept Medicare assignment. Now, one other common question I get asked is, well, what if I'm unconscious and I'm rushed to the emergency room and I haven't had time to check the government Medicare website ahead of time to see if my doctor accepts Medicare assignment? How can I be sure that that doctor in the hospital is not going to bill me any excess charges? And the answer to that is there really is no way to be 100% sure. But when we look at the data and we look at the numbers, we see that the chance of excess charges is quite small. It's a small chance, but it is still a chance. For some people, the savings in their monthly premiums is definitely worth considering Plan N, even when you factor in the co-pays and the very small chance of the excess charges. But for other people, they don't mind paying a little bit extra for that peace of mind and that convenience, and so they may be more comfortable going with a more robust benefit plan like Plan G. I think this is really where it comes down to personal preference, right? There are some people that are just more inclined to value convenience, and there are others that are more inclined to value the monetary value, getting the best bang for your buck. So you want to kind of think about what type of person you are. I also recommend considering your family history. How many doctor's office visits do you generally have per year? These should be some important questions to ask yourself as you decide whether or not to purchase Medicare Supplement Plan N. Another thing to note about Plan N is that it is one of the only Medicare supplement plans that is not considered a guarantee issue right plan. You see, for most people in most states, in most situations, Medicare supplement plans are always medically underwritten whenever you are more than 6 months past your Medicare Part B effective date. So if you want to change or switch your Medicare supplement plan or enroll in a new plan, and you're more than 6 months past your Medicare Part B effective date, then generally you'll have to pass through medical underwriting in order to qualify. And depending on your health, the insurance company could deny you. But there are certain life events that will trigger a guaranteed issue right for you to purchase some, not all, but certain Medigap plans. If you fall into one of these life event situations, then there are some Medigap plans that will be available to you without any medical underwriting at all. Plan G and Plan F are both considered guaranteed issue right plans, but Plan N is not. So what does that mean for you? It means that Plan N is ultimately going to be ensuring a slightly healthier pool of people, because more people will have to pass through medical underwriting to qualify for Plan N as compared to the other guaranteed issue right Medigap plans like Plan F or Plan G. So because of this, people on Plan N will likely see slightly lower rate increases over time as compared to folks that are on the guaranteed issue right plans. And this isn't said to scare you into getting Medicare Supplement Plan N. You're going to get rate increases no matter what Medicare Supplement plan you choose. Eventually, your rates will go up over time. It's simply worth mentioning, especially if you are very concerned with compounding rate increases in the future. Plan N does have an advantage in this respect. I think that for many people, especially in certain parts of the country, Medicare Supplement Plan N is one of the best Medicare plan options for them, and a lot of our clients do land on Medigap Plan N as their Medigap plan choice. However, it's always very important to fully understand your Medicare plan options so that you can make a truly educated decision in regards to your healthcare needs. And this is where we can help as well. Our service is 100% free of charge. My team and I are independent Medicare insurance brokers. So we work with many, many different plans and many different insurance companies all across the country. Our job is to help you find and enroll in the best coverage for your needs. So please feel free to give us a call at any time. We would be happy to provide you with free, no obligation quotes and answer any questions you may have. Thank you again so much for watching, and we'll see you soon.